Good evening, everyone. Welcome to our webinar on hip replacement surgery. My name is Louise and I'm your host this evening. Our expert presenter is consultant orthopaedic surgeon, Mr. Alex Chipperfield. We are also joined by Jean, a previous patient who will kindly talk about her treatment journey. This presentation will be followed by a question and answer session. If you'd like to ask a question during or after the presentation, please do so by using the Q&A icon, which is at the bottom of your screen. This can be done with or without giving your name. Please note this session is being recorded if you do provide your name. If you'd like to book a consultation, we'll provide contact details at the end of this session. I'll now hand over to Mr. Alex Chipperfield and you'll hear from me again shortly. Thank you.
Thanks, Louise. We good? Lovely. Hello, I'm Alex Chipperfield. Thanks very much for coming today, listening to the talk about hip replacement surgery, the journey. So what's going to happen in this session? Well, I will talk about who I am, what I do. I'll also speak about where I do it, about Benenden Hospital and how we run things here. Then I will go through the symptoms and causes and treatments for arthritis of the hip and go through the typical journey that you would go through having a hip replacement. And then Mrs. Woods will come along and talk about her experience and how she felt going through all this. And then will be the question and answer session afterwards. So this is me. I am an orthopaedic surgeon here at Benenden. I've been a doctor for 26 years, and for half of those I've been an orthopaedic consultant working here in Kent. I specialise in surgery of the hip and knee, spending about half my time doing hip replacements and half my time doing knee replacements. Benenden Hospital here is, there we go, we're a leading provider of private hip and knee treatments in Kent and Sussex. If any of you have been here, you'll appreciate that it's a clean and calm and quiet environment. It's a modern hospital, and you feel confident in the place the minute you walk in. It's a nice setup here. Things are done well. We've got a good team around us, a good team of surgeons, of nurses, of physios, of OTs, of ward staff. Everyone is very experienced and caring, and more importantly, they have the time to take to go through things with you. I think because of the environment, because of that time that we have, we get very high patient satisfaction rates and very good reviews and feedback. We also have a rapid recovery program that means that unfortunately your stay in hospital is actually pretty brief these days when it comes to this kind of surgery. I mentioned me. I'm not the only person who does hip replacements here. There are half a dozen of us who perform the surgery, all of us again experienced local surgeons who specialise in this kind of procedure. As I've said, we do a lot of hip and joint replacements here at Benenden. The numbers are high and they're getting higher. This year we will go past 1,000 joint replacements. We're nearly at that stage already, and it's not even October yet. So the volumes of surgery, the amount of work that's getting done here is getting higher and higher as the months and years go by. So hip arthritis, what causes it? What are the kind of symptoms you get, and what other treatments are available besides surgery? Basically, hip arthritis is when your hip joint becomes painful and it becomes stiff and it starts to wear out. The main cause is exactly that. It's old age. It's putting a lot of pressure through the joint over an extended period of time. And that will lead to the normally soft, smooth surfaces that glide over each other. They start to become rough, and when they become rough, the movements become stiffer and more painful, and then you get associated problems like that. So although this is a disease generally of wear and tear and of age, there are also other factors. There are diseases that can cause your hips to wear out more quickly. There are conditions that you can either be born with or that you can acquire later in life. So you can be born with slightly malformed hips, something called hip dysplasia, and this can lead to your hips wearing out at a very young age. You can develop deformities as a result of overgrowth of bones or due to injuries in and around the hip joint or muscles. These can lead to the hips wearing out. You can get diseases such as rheumatoid arthritis or gout that attack all of your joints, not just your hip joint, and that can lead to arthritis in many different places, but also in the hip. The symptoms of hip arthritis, they can vary. Not everyone will have all of these. Most people have a mixture of both, and some that dominate and others that don't. Typically, though, the number one symptom for arthritis of the hip is pain. That pain can be anywhere around the hip area. Commonly, though, it's right in the front, right in the groin. Most people, when they point to their hip, they tend to point to the side of their thigh or round into their buttock. But your hip joint is actually right at the front in the groin area. And a lot of people who think they have a groin strain or a muscle injury often actually turn out to have a problem with the hip joint, but they don't associate that area with the hip itself. So pain is number one. Like I said, it can start in the groin, it can radiate around, it can go into the side of the thigh or into the buttock. It can also track down your leg and give you pain in your thigh and also into your knee as well. So pain all around that area. You do have to be suspicious that the hip is the cause of this and needs to be investigated. Along with the pain, you start to develop stiffness, restriction in movement. That can present itself in several different ways. You can notice that it becomes more difficult to cut your toenails, to put on your shoes and socks, to stand on one leg, to put on your trousers, or to climb onto a bicycle or get into a car. These kind of things, they're the kind of the stiffness that sort of creeps up on you after a while. You can get grating or crackling sounds. That tends to be for more peripheral joints, although you do every now and again see hips that are creaking. That's a very late stage on the whole. Things have to be pretty far gone before you can hear and feel that. Due to stiffness and loss of movement, you will get weakness and you can get some muscle wasting as well. Typically, the muscle that you tend to notice that will wither away is the big one at the back, the gluteus maximus. So you may get some slight asymmetry of your buttocks, as one side would be slightly smaller than the other. So those are all signs and symptoms of hip arthritis that you may get some or all of. Treatment options. Ultimately, if all else fails, you end up talking about a joint replacement, but that's very much the last thing that you do, having tried all sorts of other things. I mean, the first things that you can do are finding ways to live with the pain, finding ways to minimize the impact that the pain has on your daily life. Simple things such as weight loss, exercise, pain-killing tablets or gels or injections, hot and cold, ice packs, hot water bottles, all these kind of things can make your pain more tolerable and livable with. Some people find that using a stick or walking poles can be helpful. Deciding on using slightly different footwear, so something with more of a cushion that will lessen the impact through your joints. Physiotherapy can help build up the strength and confidence in the muscles. There's a picture there of an injection. You can inject substances into people's hip joints to try and help with the pain. Typically, there are two types of substance you can inject. You can inject a steroid, which is an anti-inflammatory, which helps calm down the inflammation of the joint. There are other kinds of injections that you can give, lubricant injections that can help smooth the rough surfaces and allow to squeeze a bit more life out of the hip joint. Ultimately, though, if you've tried all of these and despite all that, your hip is having a significant impact on your quality of life, then you're looking at surgery. Hip replacement surgery is the mainstay. I know there's joint fusion is written down on the list here. That's an operation of yesteryear, really. The days of fusing someone's hip solid are long gone. It's historical rather than anything else. So ultimately, if you're talking about an invasive procedure, you're talking about hip replacement. Hip replacement is a very common operation. Around about 100,000 are performed in the UK every year, and this number is getting more and more every year. The average age for someone to have their hip replaced is in their late 60s. Men slightly younger than women when it comes to hip replacement surgery. But like I said, we're performing more hip replacements, and people are having them at a younger and younger age. It's still more frequent to have a hip replacement if you're a lady than you're a man. Around 6 out of 10 hip replacements are performed on ladies, and the commonest cause is for arthritis, but there are 1 in 10 will be performed for other reasons, such as those congenital conditions or the trauma or other types of diseases. It does tend to be an operation, again, that happens in people who are slightly overweight. A BMI of 28 is on slightly heavier side. Again, whether that's a symptom or a cause, whether it's a symptom of inactivity or a cause of the hip to wear out, is probably a combination of the two. Hip replacement is a hugely successful operation. If you look at patient satisfaction and the impact that it will have on your life, it's the second best operation that you can have. Cataract surgery is the number one. Having an operation that is a quick, painless operation that turns you from being blind to allowing you to see again, that's a pretty neat trick, and I'm afraid I can't beat that. But the next best surgery, as far as satisfaction, impact, and quality of life goes, is a hip replacement. So if you are heading that way, it is something to embrace and look forward to rather than be scared of. It's a fantastic, life-changing improvement that most people get. What is a hip replacement? Well, it's when you replace the parts of the hip that are worn. Essentially, the hip is a ball and socket joint. The ball is the rounded part of the top of the thigh bone, and the socket part is the pelvis, and these two articulate with each other. So a hip replacement, you have to recreate both the ball and the socket. And there's some pictures on the screen there of an old-fashioned looking hip replacement with a metal shell and a plastic lining that recreates the socket, and then there's a ball that goes on the end of a stick that fits down inside your thigh bone that reproduces the ball and socket. You put those two things together, and you get a hip joint that improves your function, gets rid of the pain, and allows you to walk and move more freely and naturally again. A question people often ask when they come to see me is, do I need a hip replacement? And the answer to that, I always tell them, well, you tell me. The decision as to whether or not you proceed with a hip replacement really depends on the impact that it's having on your life. There's no particular test or x-ray or scan that I can do that tells me that you need surgery. It's really about whether or not the cumulative effect of the symptoms that you're having are getting to the stage where you can no longer live with what you've got, and there's no other way of dealing with it. So if you're in pain every day that's limiting your activity, if your walking distance is decreasing, your world is shrinking, you can no longer do the things that you enjoy doing, it disturbs your sleep at night, you're struggling to get dressed, put on your shoes and socks, all these kind of things, will slowly chip away at you, and you'll get to a point where it becomes a condition that you can no longer tolerate or live with. And if it reaches that stage, then it's time to consider a hip replacement. When you're talking about hip replacements, there's lots of different types, there's different brands and different models. And ultimately, you will have a choice of materials, of brands, of implants, of designs, and of methods of fixing them into you. Essentially, it's the job of the surgeon and in consultation with you to decide what is the most appropriate implant for you. So what's the one that is going to last the longest and allow you to, within reason, live your life as you want to live it. And so part of the conversation and the consultation will be talking about which particular materials you need, which design would suit your particular anatomy the best, and how best to implant it. And so all of these things are considered when we're looking at which implant that we use. Here at Benenden, we only use implants that are trusted, that have a track record, that are proven to be long-lasting, hard-wearing, and reliable. There are always innovations in hip replacement surgery, and we follow those as much as we can, but we are not in the business of experimenting on people and performing operations using instruments or implants or techniques that haven't been proven as being of long-term benefit. One of the other types of hip replacement is a short stem hip replacement. That's when, if we look at this slide, the stem is about 10 or 15 centimeters long. The shorter stem is about 9 or 10 centimeters, so it's slightly slightly shorter stem, and that can be bone preserving in some patients, especially younger patients. Again, the decision as to the type of implant really depends on your specific needs and your anatomy as well. What's involved with the actual operation itself? Well, the surgery itself takes around an hour, give or take. Sometimes when things run very smoothly, it's quicker. Sometimes it's slower. Really, the time taken to do the surgery is however long it takes to do things properly. Most of the time, the surgery will be performed under what's called a spinal anaesthetic, which is when you have an injection into the lower part of your back, which makes your legs go to sleep, so you can't feel the surgery. On top of that, you do have the option to have sedation as well, so a medicine injected into your veins. That means that you won't be aware of what's going on. You won't hear, feel, see, or smell anything. A lot of people are worried that having a spinal anaesthetic means that they will be completely awake and aware and hear all the hammering and sawing going on. The only time that would be the case is if that's what you want. If you want to be completely awake, you will be. Most people will have some form of sedation on board so that you won't know what's going on. Following the surgery, most people are in hospital for 1 or 2 nights, typically, following the operation. And there will be a scar after surgery. The scar, typically, in typical patients, will be around about 6 inches long, 10 to 15 centimeters. The size of the scar, the length of the scar, tends to really depend on the size of the leg that's having the surgery. So if you are very slim, then the scar tends to be smaller. If you have a bigger leg, then the scar tends to be bigger, so that you can get down to the joint and perform the operation safely and properly. Ultimately, the size of the scar is what is needed in order to get the operation done safely. Some people use the size of the scar as a marketing tool or a sales technique. Ultimately, I don't think that's the right thing to do. You need whatever size scar is necessary to do the operation. Like we said in the previous slide, what's involved is that we recreate the ball and socket that's worn out in your hip by with a combination of a shell and a stem. We cut away the top of the thigh bone. We hollow out the socket in the pelvis, and we can impact the implants into those, put them all back together, and sew you up again. So all very straightforward. These are a couple of X-rays of the appearances of hip replacements afterwards. The picture on the left-hand side of the screen is someone who's had both of their hips replaced. These are what we would call a hybrid hips. So they have a cemented stem and an uncemented socket. The single sign on the right is a fully uncemented hip replacement where both the stem and the socket have been uncemented. Both of these are, like I say, incredibly hard-wearing, long-lasting constructs. The exact nature of which one is right for you will be determined before and during the surgery itself. Recovering from a hip replacement, ideally we get you up and walking as quickly as possible. It's perfectly safe to bear all your weight through your new hip on the day of the operation. If you have surgery in the morning, you'll be walking in the afternoon. If you have surgery later on that day, it may well be that the effects of the anaesthetic don't wear off in time for you to walk that day. So we give you the night off, and then we start chasing you around the place the next day. It can be a bit tight and a bit stiff and sore following the operation. Most people tend to find that the pain that they came in with, the horrible toothache grinding pain from their hip, has gone straight away. The pain that you have after surgery is different. People often describe it more as a discomfort or a tightness around the hip. And that pain will fade and settle as you heal. You may get some swelling and bruising around the leg. That's very common to get some bruising. One of the medications that we give you after a hip replacement is medicine to try and prevent you getting a blood clot. One of the side effects of a medicine that stops you from getting blood clots is that it stops your blood from clotting. So any bleeding or bruising that you will get from surgery will be amplified and magnified by the medication that we give you. So you will have some bruising and swelling. It's completely normal. It tends to settle within a few days or weeks. Most people, you'll be in hospital 1 or 2 nights and get back to normal around 6, 8, 10 weeks, depending on how you respond. And really, it tends to depend on where you started from. If you're starting from a very low point, if you're very stiff, very weak before the operation, then it will take you time to build up the strength, the confidence, the muscles in and around your hip again afterwards. So it will take as long as it takes for you to find your feet. But the pain relief is very rapid. Once you're happy that you can cope, and once you've ticked all the boxes, if we're happy with your blood tests, your x-rays and your mobility, you'll go home. Most people will go home on a pair of crutches, and you'll be in a situation where it's safe for you to cope in the environment that you're being discharged to. Most people get rid of their crutches after a couple of weeks, either going from 2 crutches to 1 to none, or from 2 to none, depending on you, really, whatever feels safer with you. But that generally you'll be walking around within a few weeks unaided. You may find that you're back driving within the first 6 weeks or so. I tell most people to not make any big plans for the first 3 months following an operation. So that includes long distance travel, getting back to high demand work activities and exercise. It's a gradual process that will take as long as it takes for you to get there. Life after hip replacement. Not a fan of this slide because this shows lots of situations where you're not allowed to do things. The whole point of this operation is to allow you to get rid of the shackles that are holding you down, get rid of the thing that's holding you back, and allow you to get back to living your life, and living your life in a much less restricted, pain-free way. There are some activities that common sense would say don't do them, bungee jumping, some high impact sports. Hip replacement surgery is not carte blanche to start running marathons again, but within reason, most people are able to get back to doing most things. It may take some time to build up the strength and confidence again to get there, but you will be able to get back to 99% of the things that you used to be able to do and want to be able to do. There are some restrictions that we put on you for the first month or 6 weeks or so while things are knitting together and healing. But once that healing period has gone, the chances of you causing damage to your hip without doing something either incredibly unlucky or incredibly stupid are very small, and it's not something that you would need to worry about after that initial bedding in period. Although hip replacement is a great operation, it works very well, there are potential risks. There are things that can go wrong either during or immediately after the surgery. And you know, these are the facts. It's not 100% guaranteed to be perfect. Sometimes bad things can happen. Everything that we do in the build up to and during the surgery and afterwards is all designed to minimize the risk and minimize the likelihood of anything bad happening, but still sometimes things can happen. If bad things do happen, then we do our best to make everything right, and most of the time you can do that, but sometimes things can go very wrong and you end up in a worse state than you were beforehand. That fortunately is very rare, but it can happen. Typical problems, I mean, there's a list of potential problems here. I could spend all night talking about those and others. You know, you could get blood clots. You can get dislocations. You can get alterations in the length of your legs. You can get damage to the muscles, to the nerves, to the blood vessels, to the bones themselves. You can get infection, and an infection in a hip replacement is a catastrophe. Fortunately, hip replacement infections in an environment such as Benenden are very rare, but when they do happen, they are serious. Revision surgery, I wouldn't say that's a risk. You know, artificial joints, if you have an artificial joint for long enough, that it may well wear out. I mean, most modern implants last for decades, but if you're having a hip replacement in your 30s or your 40s, then it's not so much a risk that hip replacement may well wear out in later life. It's pretty much a certainty that eventually things will wear out if you live for long enough. So revision is an end point rather than a risk, and it may well there is a chance that you might end up needing further surgery later in life if the hip replacement that you start off with does wear out. How do you decide A, whether or not to have a hip replacement, and B, who to do it and where to have it done? There's lots of decision-making tools out there. The NJR that we talk about here, this is the National Joint Registry. Every joint replacement that is performed in England, whether it's in the private or the public sector, is registered, is kept on a joint registry, and this has been the case for the last 15-16 years now. So the National Joint Registry is becoming a more and more powerful tool. It's a very useful source of information about what particular hip replacements or joint replacements in general, how long they last, how well they perform compared to other types of joint replacements. There's also all of us are registered on the NJR. So if you go to the National Joint Registry, you can click on My Profile, and that will show you exactly how many operations of this kind I perform every year, and what my complication rate is, what my how long my surgery lasts. So all of these things will give you information about a surgeon. Typically, what I would recommend that you do is that you look for someone who performs these operations frequently. You want what we call a high volume surgeon. So someone who does half a dozen hip replacements every year is not what you're looking for. You want to see someone who does hundreds of hip replacements every year, who what they do morning, noon and night is this kind of operation. Because the more experience you have, the more familiar someone is with the procedure, then the more likely it is that things will go smoothly. Look at my data, you'll see that I'm one of those people that performs this operation regularly, many hundreds of times every year. It's what I do. So from that point of view, look for me or someone like me who has that kind of numbers. That will give you the confidence that you need, that we know what we're doing. You can also look at review sites such as Doctify or Top Doctors or I Want Great Care. All of these websites are out there that give you an idea of how people interact with you, what people's bedside manner is, and how institutions and individuals are, and how nice they are. They won't give you an idea of the success rate. That's what the joint registry will do. That gives you more of the cold hard data as far as that goes. There's also a website at the bottom here, which is part of the National Joint Registry website, that is called a patient decision support tool. And that gives you an idea. You go onto that website, you can put in your symptoms and how your joint is affecting you on a daily basis, and a few other details about your general health and age and mobility. And that will use the experience of millions of joint replacements that have happened before you to give you an idea of what kind of change, what kind of impact, what kind of benefit you would expect from a joint replacement. So if you are considering surgery, that is a very useful tool to look at. To give you an idea of how things might work for you. So in summary, a hip replacement is a very common operation that we perform very frequently here in a very clean, safe environment. It has a significant impact on your quality of life. It will make a big difference. It's reliable, it's safe, and it's good surgery. So if it is appropriate for you, my advice is don't worry. Come here, come and see someone like me, come and see the environment, come and talk about your problems. And if there's something that we can do to help, and if we're looking at hip replacement, don't be afraid, it will make a huge difference. Now I'd like to hand over to Mrs. Woods here. Jean is a lovely picture of her, and she can talk to you about her experience from going through this kind of operation. So I will put myself on mute and hand you over to Jean.
Thank you. Hello, everybody. Can you hear me? Yes, good. Okay, thank you, Mr. Chipperfield. Hello, everybody. As Mr. Chipperfield said, and as you can see, my name is Jean Woods. Mr. Chipperfield performed a hip operation on me this year at the end of January, just to give you a little bit of background. He's mentioned symptoms, and mine followed that sort of trajectory. I started with pain in the groin 3 years ago, and actually went to Sevenoaks Hospital, where they gave me some exercises, and that seemed to keep it in check for quite some time, I would say. But then it travelled down to my my knees, but also I had some pain in my back. But the main issue is that it did impact on my life from autumn time last year. As you can see, I had difficulty climbing over stiles. I belong to a walking group that meets monthly, and everybody was surprised that as I'm the tallest in the group, that I had difficulty getting over the stiles. It seemed to happen quite rapidly. I also couldn't tie my shoelaces, and this all cut my toenails, and that did distress me. So I went along to the GP again and said, please, can I have some more exercises? To which he replied, having tested some flexibility, etc., and movement, rotation, he basically said, sorry, it's hip replacement time. And if you're listening to me, then you yourself would actually know when that moment has come. And so the next thing is, of course, to have an appointment at the hospital where you go through pre-operative assessment, where you're asked what medication you're on and all sorts of things. On that occasion, I took my son with me. And I'm glad I did, because he was able to take some notes, because I was in a little bit of shock, because I'd gone along thinking that I would have a general anaesthetic, only to be told that recovery was much quicker from an epidural, which Mr. Chipperfield, has referred to. This caused me quite a lot of anxiety, unfortunately. But my nickname for Benenden Hospital is the hospital that listens, because if you, listening to this evening, have got any sort of problems or issues that are personal to you, do share them when you go for the assessment, because the nurse there really listened to me. And she wasn't happy until she felt I was reassured. Now, she also mentioned that an anaesthetist would ring me to assure me even further, which indeed he did. And just to give you an indication, she took so long with my son and I that in actual fact, my son began to get really worried, because his son was at a sports practice after school, and my son was meant to meet him. So he ended up ringing his wife. So we were, I'm sure, holding up other people, but I didn't go until I felt reassured. So, of course, the next step from that is that you have a consultation. In my case, it was with Mr. Chipperfield, and immediately to that one, I took my sister. I sort of shared the burden. Basically, immediately, we felt his warmth. We liked him. I hope all this isn't going to go to his head, but we felt something that you can't touch, intangible. We trusted him, and I felt happier knowing that he would be the consultant who would be performing the hip replacement on me. Now, if I sort of say that Mr. Chipperfield has referred to the joint registry, then I do like stats. It's just the way I'm made. And so I did have a look at his stats. And of course, that also was very encouraging. Now, I have sort of mentioned that at the pre-op, I was concerned about the epidural, but unfortunately, when the day of the operation came, it really raised its head again, and I'm quite ashamed to say, really, it was embarrassing. But when the anaesthetist came into my room, he could see that I wasn't the happiest bunny around, to put it mildly. And he basically said that I was third or fourth on the operation list that afternoon, and that for me to wait around all those hours would not be good for me, which I concurred with completely. And so he said that if they hadn't got the equipment in the operating theatre for the first person on the list, then he would see if the schedule could be changed around. And indeed it was. And I was first on the list. Now, which hospital would do that for you? Not only had they listened to my concerns, but they'd actioned around it on the day of the op. And of course, what helps you feel reassured as well is that, as Mr. Chipperfield said, the facilities and the surroundings, given that Benenden is in quite a rural location, are both very quiet and comforting. You have your own room, and that certainly really does help tremendously. And during the time that you're in your room, I can't fault any sort of care I received from the staff. But just going back to the surroundings, I have to say something that maybe some of you appreciate is that, touch wood, I haven't needed to be involved in hospitals very much so far in my life. But my sister is not a very well lady, and so I've accompanied her. And I don't even like going into her hospitals because they smell of a horrible smell. Now, I've got no medical background whatsoever, but I was in education, and people tell me that schools have a strange smell. Benenden has no smell whatsoever. It's like a hotel. You go into the reception area and it's like going into a rather nice hotel. That's what I think. Going back to the staff, everybody seemed to work very well together. And what I liked, although I hadn't got experience of sort of staying in hospital, so to speak, it's the fact that the nurses seemed to anticipate what I wanted. So it wasn't always a case of me thinking, I need this, or I wonder if. It was a case of, let me get, or they would, as I say, know the next stage. And that was lovely. The physio team were very helpful. Everybody can't really do enough for you, I felt anyway. And now if I move on to the fact that my life has really got back to where it was before, I love walking. You probably gather from the fact that I couldn't go over styles. I belonged to several walking groups, and in fact used to lead a walking group as well. So I was delighted. What I really wanted was, once Mr. Chipperfield had discharged me, or before then even, I'd had my eye on 1 or 2 holidays. And in June, I went on a holiday to France, northern France. It wasn't billed as a walking holiday, but it was actually, it did say that if you couldn't walk X amount, then please stay in the hotel for the day. That week, I walked 4 miles every day. Now, some of you will say, oh, that's not very much or whatever, but I was pleased that I walked more than a marathon in a week's away. That was good for me, even though I'd walked a little longer during other days before my holiday, but not all in one session. That was the important thing. So moving on to advice to any of you this evening that are considering hip surgery, I would say a couple of things really. I think first of all, it was very helpful that I had family members with me. And basically, if you're at the stage where you haven't had any consultation yet or whatever, if you could take like a good friend with you or a member of your family, I think that would be helpful. I mean, I've accompanied my sister many times, but you feel quite different because you're the one taking the notes when you're accompanying. But I felt that I'd missed one or two things, and it was reassuring that both my son and my sister told me one or two things after the actual appointments. The second thing is, when I talked to friends who'd had hip replacements before I went in, they all stressed it was very, very important to do the exercises. Now, I may walk, but I'm not, I used to do quite a lot of swimming, but I'm not what you call a gym buddy at all. I don't like weights, so I don't like doing exercises in a gym. So it was quite demanding for me to actually discipline myself to do these exercises 3 times a day and so many different sets. But I realized that maybe that was one way to get me back to where I wanted to be and would aid my recovery better. So if you can discipline yourself to do that, I would say that's quite important. Also, as you have heard me say, that I had anxiety over the op. Well, if you have any anxiety for whatever reasons, it might not be for the same as my concern over the epidural, but basically steel yourself to have the op, because the situation isn't going to get any better. And, you know, sort of have a little argument or conversation with yourself internally and go with it. And so I think those are really the 3 main points. The other thing is, I just do not think you could have better care than at Benenden. And if you decide to go ahead for whatever reason, etc., then I wish you all good luck, and I hope it's as successful for you as it has been for me, because I feel like regarding my hip, I'm a new person, truly.
Thank you, Jean. Thank you very much, Jean. That was really, really, really good and really informative. So thank you for joining us there. I'm just going to go through some questions now, if that's okay. We have quite a few that come through. The first we have is from Alan, and he says, how soon after a steroid injection in the hip can I undergo a hip replacement operation?
I guess that one's for me then, rather than
Yes.
for Jean. Yeah.
Yes, let's assume that for you, unless I say otherwise.
Okay. Well, the first thing to say is that ideally you shouldn't have to, because if a steroid injection works, then that would get rid of your pain and help things. And steroid injections can give you several years of pain-free living. If the injection hasn't worked or has worked but now has worn off, and you're thinking about hip replacement, then I get that's a different question. This is going to come back. This question has come back to haunt me so many times. When I was a junior doctor, this was about 20 years ago. One of the things that you have to do in order to progress as a surgeon, apart from learning what to do and how to do it, one of the other things that you have to do is you have to do some research, and you have to publish some papers and this kind of stuff. And so I was working in a department in Eastbourne at the time, and we looked at the risks of having surgery after having a steroid injection. And what that research showed was that if you have a joint replacement within sort of 6 to 12 months of having had a steroid injection, there is there's a slightly higher risk of developing, of getting an infection after the surgery. Now, this was a study that I was part of, so I know in quite a lot of detail. And I do also know that the risk of developing infection is really, really tiny. It's a very small increase. It's barely statistically significant, but it was enough to publish a paper to allow me to progress in my career. But the trouble is, you get haunted by these things, and the number of times people worry that having an injection completely negates or limits the time before you can have a definitive procedure. So the answer is the real risk is minimal and negligible. If you want to be 100% safe, try and wait around 6 months to a year following an injection before you have a joint replacement.
Makes sense to me. Thank you. We've had 2 questions around how long does a hip replacement last. So both people are younger, and so they're just wondering how long, if they've had one now, how long would it last for approximately? Would they have to have another one?
Like I said in the talk, these things they do have a finite lifespan. They don't last forever. Modern hip replacements do last for decades. A lot of it depends on you, what you do with it, and what kind of stress you're putting through it. Probably the best thing to do is if you look at the survivorship of joint replacements on the National Joint Registry. You can also look at the part of that patient decision tool that I spoke about. One of the things that it gives you when you put your numbers in there is the likelihood of you needing to have a revision later in life. As a rough estimate, so like I said, the average age for someone to have their hip replaced is in their late 60s. If you have a hip replacement in your late 60s, the chances are it's going to last you the rest of your life. There are some, from a wearing out point of view, there are some reasons why you might need a redo hip replacement that are outside the remit of the hip wearing out or not. Infection can strike at any time. Trauma, so falling down a flight of stairs, breaking the bone around the hip joint, that kind of thing. There are some conditions that mandate revision that don't involve the hip joint wearing out, is what I'm trying to say. But generally, if you're in your late 60s and you have your hip replaced, there's a more than 9 out of 10 chance that it will last you the rest of your life. If you're in your 50s, that chance is lower, but it's still more likely than not that it will last you the rest of your life. The survivorship of a hip replacement, of a modern hip replacement performed in someone in their 50s, you're looking at 7 out of 10 chance that it will last you the rest of your life. If you're in your 20s, then it's unlikely. Then the numbers are reversed, so it will be a 7 or 8 out of 10 chance that it will wear out before you die. But so generally, young people with hip replacements still have many decades of life left in them. There are causes for revision that don't come from the hip wearing out, but just from bad luck or other problems. But on the whole, modern hip replacements last an incredibly long time. Hopefully that's answers enough.
Yeah, it's comprehensive. So keeping with the age theme, someone has asked me, there's an upper age limit for hip replacement? So, and is it better to do it earlier, even if the symptoms are not too bad yet?
So the second part of that question, no, it is not better to have any. This is a big destructive operation to have, and the only reason to have it is if you need it at the time. Don't have an operation and it's not one that you don't get any bonus points for getting this done early in life. You have it when you need to have it done, when nothing else is working. Is there an age limit? No, not really. What it boils down to is your general health rather than your age. So it depends on how healthy you are, what other medical conditions you may or may not have, what your general physiological state is like. And that will be assessed before the operation at the pre-assessment. So I've known some incredibly healthy 90-year-olds who've had hugely successful hip replacement operations. I've known some incredibly unhealthy 50-year-olds who've been refused surgery on the basis of their health. So age is not the issue, your health is, and that will be looked into extensively before you will end up with a hip replacement.
Thank you. Nice and simple one. Would I be able to use my private medical insurance at your hospital? And
Yes.
I think I know the answer to that. It's definitely yes.
Sorry, yes.
So, yes. Anthony asks, how long after surgery do you have to adhere to the 90-degree rule? Is it 6 weeks?
Generally it's around 6 weeks. To be honest, it's not. You're not going to be stood there with a protractor in life, measuring every seat that you're about to sit in to make sure that you don't bend too far. Really, what it boils down to is you just have to take a little bit of care while things are healing up. As a general rule, if you're living within the limits of what feels comfortable, if you're doing something that feels unusual or something that feels uncomfortable, then pull yourself back from that. So really, it's rather than focusing on a precise number, it's more about listen to your body. It will tell you if you're doing something that it has potential to do harm or not.
Yeah. Okay, we just got a couple more questions. Would you mind moving on one slide, please? We've just got a couple more.
That one or the next one?
Yes, if you go on to the next one, just in case people are running out of time. We do have an offer for people, which I'll go over in a minute. This person says, I'm waiting for a hip replacement, but I have also been diagnosed with polymyalgia. Thank you.
Yeah.
And
rheumatica.
Thank you. And they're on
prednisolone.
No. Oh gosh, this is too much for me. Will that affect a hip replacement?
Yes. And yes and no. So polymyalgia rheumatica, you don't need me to tell you because you're suffering with it, but for everyone else, it's when you get inflammation and pain affecting multiple muscles and joints. In fact, I had a patient this afternoon who has it, who when it was bad for him, when it was so bad, he couldn't even move. He couldn't get out of bed or out of a chair. So it can come on like a wave and it can cripple you. Prednisolone is a steroid, which is an anti-inflammatory, and that seems to be the mainstay of treatment for this. People with polymyalgia rheumatica tend to respond very well to steroids. The problem is that when you're first taking those steroids, you take very high doses. You have to hit this condition hard with a high dose of steroid, and steroids are one of these medications that you can't just start and stop. It has an effect on your body as a whole, and generally, once the high dose has got the polymyalgia under control, you would then tail off the amount of steroid that you take, ideally to a point where you're not taking any anymore. Some people, though, are on a maintenance dose of steroid that they have to take for the rest of their life. The good thing about those steroids is that they keep the polymyalgia at bay. The bad thing is that steroids can have an effect on the rest of your body, and that's where it comes into play when you're talking about surgery. So it may well be that you need an extra dose of steroid during the operation at induction. Quite often, people who are taking long-term steroids are given an extra shot of steroid during the surgery to make up for the trauma that your body goes through. It can have an effect on your soft tissue, so it can make your skin quite thin and weak. It can make you more disposed to bruising and bleeding. It can make your bones weaker, which would have an impact on the kind of implant that we might use for a hip replacement. People on steroids with weaker bones, they're much more likely to require a cemented hip replacement rather than an uncemented hip replacement. So you'd reinforce the weaker bones with cement around the hips themselves. The other thing that steroids do, especially in high doses, is that they suppress your immune system. And so that can put you at a slightly higher risk of developing an infection following surgery. So all of these things would need to be taken into account. Ideally, if you can get to the point where you're no longer on steroids, I would wait to that point before you have a hip replacement. If you are stuck on a maintenance dose, then those things will be taken into account. There will be some modifications in what happens before and during the surgery, but there's still the chances are that your surgery will be a huge success and it will be a great thing. What it won't do is it won't have an impact on the rest of your body, which will still be suffering with the polymyalgia, but at least one painless joint is better than no.
Okay, we just have time for one more question. What's the difference in having a cemented hip as opposed to a non-cemented hip? And how do I know whether my first hip replacement is cemented or not?
So if you've had one, the best way to find out would be to ask your doctor, ask your surgeon, because they will tell you. The thing is, yeah, the difference between the two is that you wouldn't notice the difference because it's not something that you register. A cemented hip replacement, a half cemented hip replacement, or a completely uncemented hip replacement, they all feel the same when you've had them. What the difference is, there's two differences really. One is a difference of necessity, and one is a difference in philosophy. So the necessity I touched upon with the steroids. If you have quite weak bone, then an uncemented hip replacement, there's a risk of a broken bone with an uncemented hip replacement, and there's a risk during the surgery, but also afterwards. There's a risk that the bone around the hip replacement could be the weak thing that fails. So to hold the hip replacement in more firmly and to reinforce the bone around it, you would use cement in that instance. So if there is very weak bone, extremely osteoporotic bone, or if you have a disease or medication that weakens your bones, then chances are your surgeon will probably use a cemented implant to help reinforce that. The other side of it is the philosophical side of things. Learning to be a surgeon is an apprenticeship, and you learn your surgery over the years by working in different hospitals with different people, observing their techniques, taking on the good bits, disregarding the bad bits. I trained mainly in the southeast of England, and then I went over to Australia and performed a fellowship over there. And the southeast of England is traditionally an area of the country where we use less in the way of cement. And Australia, that's when I was in Sydney and also in Brisbane, again, it tends to be a less cemented part of the world. So the majority of people who taught me hip replacements taught me uncemented hip replacements. Now, being a fully rounded individual, I learned how to do cemented hip replacements as well, because you shouldn't only know how to do one thing. But there are other parts in the world. So if you were to go to the northwest of England around Manchester, or if you were to go down to the southwest of England around Exeter, you would find that the overwhelming majority of hip replacements that are performed in that part of the country are cemented. Again, because that's the philosophy, that's the training in that particular region. If you look at the outcomes, if you look again, I keep harking back to the National Joint Registry and other registries around the world, but if you look at the difference between how a cemented hip replacement and an uncemented hip replacement, how they perform in the long term, if you look at the outcomes, they are indistinguishable. In the early days of uncemented hip replacements, the argument from the cemented group used to be that cemented hip replacements have the longest heritage, the longest track record, and last the longest. Now that uncemented hip replacements have been around as long, they have demonstrated the same heritage, the same longevity, and in some instances actually better, longer lasting results than the cemented. So it's a difference of necessity, philosophy. It's what when you get a group of hip surgeons together at a conference, it's what we spend hours arguing with each other about. My best friend, who is also a hip surgeon who works down in Exeter, it's what we bore our wives about constantly when we all get together and have a chat. We bicker about this kind of thing. So there really is no difference as long as it's done properly. It's an whichever is the most appropriate for you. And the way to tell would either be to look at the X-ray or to ask your surgeon exactly which one they've done, because you won't notice a difference.
Great, thank you for that very comprehensive answer. So yes, I think that's the end of our Q&A sessions. We have run out of time, but if we, I did notice a few more questions. So if we've seen your name, so we will answer yours via email afterwards. I hope that's okay. So thank you for joining the session. And as a exclusive kind of September offer, we are providing the value of your consultation refunded back upon booking your operation. You also get a callback from my dedicated private patient advisor, and you'll receive an email tomorrow with a recording of this sessions with further information. So if you missed any of the questions or information, you can watch it all again, or just to remind yourself. And of course, you will then get any updates on news and future events. If you'd like to discuss or book your consultation, our private patient team can take your call until 8 p.m. this evening, or they're available between 8 a.m. and 6 p.m. Monday to Friday on using the number on the screen. We'd also be grateful if you complete the survey when the session closes to improve our future events. And our next webinar is quite a different subject, on breast enhancement surgery, which you can sign up to via our website. Our website will have a list of various other webinars as well. So on behalf of Mr. Chipperfield and Jean and our expert team at Benenden Hospital, I'd like to say thank you very much for joining us today, and we hope to hear from you very soon. So thank you very much and goodbye.